morning and welcome everyone to our 2021 webinar series for the HR Department of the Year Awards. We are very excited to have Kevin B. Mahoney, CEO of University of Pennsylvania Health System, as our featured speaker this morning. My name is Scott Rosen of the Rosen Group and also founder of the HR Department of the Year Awards. So our agenda for this morning, we're going to do a little bit of background on the HR Awards program, talk a little bit about the program this year, and then we're going to get started. We have a few spotlights for our sponsors. Then we're going to get started with Kevin's presentation, which is going to be hosted by John Toohey, partner at Salveson Group. So just a little bit of background about the program. We were founded in 1998, so we have a long history of a relationship with the HR community in the greater Philadelphia area. The initial reason for starting the event was my belief that HR professionals, and I had been part of corporate HR functions, didn't get enough recognition and didn't get enough spotlight on their best practices and accomplishments. And so I wanted to raise the bar on the HR community. And we believe that we've done that over the past 24 years. Our hosts today are myself. We have Challenger Gray and Christmas, which is represented by David Panett today. We have Marcia McLennan, Tryon, which is represented by John Ford today, and Salveson Group, which is represented by John Toohey today. We'd also like to thank all of our sponsors. We would not be able to produce a program like this without our sponsors, and you're going to be hearing from several of them today, and they're going to just tell you a little bit about their business. And again, a big shout out to all of our sponsors today. So just a little bit about the awards program. We are going back to a traditional format this year, which means we are planning on a live event. That event is going to be on November 10th. We'll say more about that. We are also going to have this a little bit different in terms of the competition this year because of the unusual circumstances last year. We had a virtual event and we had a different judging process or honoring process. But this year we're going back to a more traditional approach to the program. Also, you can see the list of finalists. We have 18, 19, 20 companies being represented. You'll probably recognize some of the names. We're really excited. And those finalists are broken down into different categories, but you'll learn about that later. So our event this year is going to be at the Crystal Tea Room, which is a beautiful, beautiful facility. We've probably been there, gosh, I don't know, 10, 12 times at least over the last 25 years. The event is going to be on November 10th. It's going to be from 5:30 to 9:30. You can register now at hrawards.org. We are going to follow all the COVID protocols that are in place at that time and probably even go, a little bit beyond that. So it will be a safe event. And people should feel comfortable coming to the event. So we're looking forward to that celebration. So I want to announce a couple things in advance. Most of our finalists and winners are not notified or communicated to them or to the attendees until the night of the event. But we do have two very special honorees that we are going to mention now. The first is we do a CEO of the Year event, and that event this year is going to be awarded to Tony Pergolin, who is the president and CEO of Bancroft. Bancroft is a great organization, a nonprofit organization which provides social services to people in need. And at the night of the event, we will honor Tony. And we also have over the years offered what we call a Lifetime Achievement Award. Typically, that award is selected by companies and HR leaders who have won multiple times in the award program and who have demonstrated, excellence in the HR function at a level that, is really, really high and really notable. So this year, our honoree is Cam Hicks, who is the corporate VP and Chief Human Resource Officer of Teleflex. And so we are really happy to have Cam as our honoree this year. And kudos to both Cam and to Tony. So we're going to go ahead and get started right now. And we're going to do a couple spotlights before we get into Kevin's presentation. We are going to start with one of our sponsors, Comcast Business. We're delighted to have Comcast support the program this year. And I'm going to turn it over to Mike Loudon, who is the Regional Vice President of Comcast Business. Thank you, Mike, for joining us today.
Hey, thank you, Scott. Hey, good morning, everyone. As Scott mentioned, my name is Mike Loudon. I'm Regional Vice President of Comcast Business here in the greater Philadelphia area. We're proud to sponsor the 2021 Delaware Valley HR Department of the Year Awards, and we're excited to be here today for the fireside chat with Kevin Mahoney, CEO of UPenn Health System, and one of our tremendous business partners and valued Comcast Business customer. For those not familiar, Comcast Business supports businesses of all sizes and industries across the region. As a leading technology connectivity provider in the Delaware Valley and really a rising leader in technology solutions for the enterprise market, we are committed to constantly investing back in the community here in greater Philadelphia. We just announced a $26 million investment to expand our network throughout the greater Philadelphia and New Jersey areas, which will reach another 4,000 businesses directly and benefit thousands more by making our network more accessible and affordable. In fact, we've invested since 2015 $100 million in network expansion to benefit nearly 25,000 business customers. Comcast Cable is also committed to its efforts to support small businesses owned by people of color. The Comcast Rise Investment Fund, launched in late 2020, has provided nearly 4,700 business awardees a total of $11 million in grants, marketing, technology support. Our longstanding commitment to diversity, equity, and inclusion is also evident through our $100 million pledge to help drive lasting reform and champion a more connected, equitable, and just world. Our goal is to foster a culture of inclusion and ensure all our employees feel supported, embraced, and heard. And it's with that in mind that we recognize the immense value of our HR awards and the recognition it rightfully bestows upon such a tremendous group of HR professionals and what they do to contribute to the growth and change of their organizations. So once again, thank you to Scott and team for putting together such a fantastic program, including today's webinar, as well as the upcoming HR awards. We are certainly glad to be part of it. So thank you, Scott.
You're welcome, Mike, and thank you so much for being a sponsor with us.
You're welcome.
And our next sponsor spotlight is Emerson Group, which is a staffing firm in the area, well known, and have been around for a long time. And I'm going to introduce Flo Ryan, who's the VP of Business Development from Emerson Group. Flo, great to have you this morning, and turn it over to you.
Thank you, Scott. It's great to be here, and thank you for all you're doing with this great awards banquet and everything that's involved. Most of you probably are familiar with Emerson Group. I hope you are. We've been in business for 50 years this year, which we're very excited to celebrate that anniversary. Bill Emerson is the owner. His mother and father started the company 50 years ago. Emerson Group specializes in two different divisions: staffing and office administrative, temporary, temp to hire, direct hire. And we also have a professional search division, which we handle all corporate professional. And 2 years ago, we launched our Emerson HR division. We've always handled human resources, but we wanted to have a stronger focus in the area. And Carme Cipriati-Farr, who unfortunately can't be here today, she's at the ASA conference in Colorado, lucky lady, but she has done a fabulous job heading this division. And although most of our business is really in our backyard, within the greater Philadelphia area, we are proud to say that we've expanded nationally. Carme has been making placements throughout the United States, just recently a few different roles in California and a few other states. So our area of focus in Emerson HR is anywhere from a senior generalist up to C-level, every position in between with various focuses. And then again, we do have our other divisions as well. And that's a little bit about us. I thank you very much for this opportunity to spotlight Emerson Group. And thank you again, Scott, for this opportunity and for this wonderful awards banquet you have put together.
Thank you, Flo. Happy to have you. Okay, we're going to get started with the program. Next, we're going to have Ben Dutcher, account executive with Kelly Benefit Strategy, who's going to tell you a little bit about Kelly and then introduce the program. So Ben, welcome. Happy to see you today.
Thanks, Scott. You too. Appreciate it. And good morning, everyone. Our team at Kelly Benefit Strategies is proud to be partnering with the HR Department of the Year Awards again this year. It's always a great event, and we're thrilled to help bring recognition to some of the top leaders and HR teams in our area. And just briefly about Kelly, for the last 45 years, our team has been focused on helping our clients develop better benefits programs to improve the health, productivity, and engagement of their unique employee populations. And today, I have the privilege of introducing our speaker, Kevin B. Mahoney. Kevin is the Chief Executive Officer for the University of Pennsylvania Health System. As a seasoned leader at Penn Medicine, he has led several transformative projects during his 25-year tenure, which have expanded and enhanced Penn Medicine's clinical care, teaching, and research missions. Kevin is currently directing the development and construction of a new $1.5 billion hospital called the Pavilion on Penn Medicine's West Philadelphia campus, which opens this October. Kevin has served on numerous boards for nonprofit organizations in the Delaware Valley and has been recognized as a Philadelphia Business Leaders in Healthcare 2021 honoree by the Philadelphia Business Journal and as one of the 76 most influential people in Philadelphia by Philadelphia Magazine. He's a graduate of Millersville State College, where he earned a bachelor's degree in economics, and he holds an MBA and a doctorate from the Fox School of Business at Temple University. And today's discussion will be moderated by John Toohey. John is a principal of Salveson Stetson. He's also a partner of the HR Department of the Year Awards. And so with that, John, I will turn it over to you.
Thank you, Ben. Really appreciate that, and very excited to be talking today with Kevin Mahoney. Kevin doesn't really like talking about himself, but I'm going to talk about him just a little bit. Kevin had the misfortune of being born in Boston, but the good fortune of moving here when he was only 4 years old. So we're going to claim Kevin as a native Philadelphian. If you don't mind, Kevin, we'd like to do that. And your 50 plus years in the community, I think, warrants that. And I also want to say that we are so lucky to have an institution like Penn Medicine, University of Pennsylvania Health System in our community. It's one of the premier academic medical centers and research centers in the world. For those of you who don't know, Dr. Kathleen Carrico and Dr. Drew Weissman did the groundbreaking work on mRNA that has allowed us to develop the vaccines that combat COVID today. Through its 44,000 plus employees and a myriad of both inpatient and outpatient medical centers throughout the region. Penn is not only medicine is not only one of the most important healthcare institutions in the region, but also really one of the most important institutions in the region overall. It's the largest employer in the city. And what I appreciate about Kevin and about the system is it takes its role as a community anchor very, very seriously, both in terms of the people who work there and its place in the community. As Ben said, Kevin has really orchestrated some very transformative initiatives in the history of the organization. None more so than the new pavilion that will be opening up in November. 504 bed facility. I think of those 44,000 employees, maybe 10,000 will be working in and out of that organization on a daily basis. And before we get into some of the richly deserved recognition that both the system and Kevin received through the the awards ceremony last year, I did want to talk to you, Kevin, just a little bit about the new pavilion. It's opening up in November. I'm just curious, what excites you most about the opening of this new facility and the impact it's going to have on our region?
The most exciting part about it, I think, is innovation. We innovated how we build it. So about 30% of the building was built off-site in West Philadelphia. And so all the bathrooms, for example, were built in a warehouse, the head walls, the risers. That allowed us to get completed faster, to have better quality control. More importantly, the safety of the contractors was just enhanced because you weren't up on a ladder. You could do things right in front of you. So safety, quality control, renting space in West Philadelphia, shortening the schedule. So innovation in construction, innovation in healthcare delivery. So if you go onto our neurosciences floor, it is a demonstration of what makes Penn unique. We have patient care and we have research side by side. So next to the epilepsy monitoring unit are the epilepsy researchers. And it makes translation happen so much quicker when the patient, the doctor taking care of them, and the scientist who's learning from the doctor about the disease are side by side. And it's worked on the outpatient side in cancer treatment. We're bringing it forward now on the inpatient side.
That's great. And we as a community are very excited about the opening of the facility. And I'm just curious, I mean, huge undertaking on a number of different levels, but what are the people challenges of opening a facility like this, and kind of how has your HR group kind of helped you in terms of preparing for this opening and moving forward?
Sure. Denise Mariotti, who's the chief HR executive at the Hospital University of Pennsylvania, has been taking the lion's share, together with Cindy Morgan in our Penn Medicine Academy doing the training, Dwayne Duckett. But it has been probably more than any other challenge we've undertaken, just paramount for HR, because there's so many facets. We have to recruit about 600 incremental positions to move in at a time of workforce shortages. You have the haves and the have-nots. But why are some of the people going into the new hospital, but I'm still in the 1920s building, and we have to go through that. I have to learn an entire new way. As you mentioned, we have to train over 10,000 people.
Yeah.
At a time when everyone's maxed and stressed, and it's one more thing that we're putting on. So, and then we span from Lancaster County to the Jersey Shore. And how do you make sure that there's not so much focus on 1.5 billion that the people that are not working in the building but in our surrounding hospitals feel part and understand how all this links together? So I think it's been a communication challenge, it's been a hiring challenge, it's been a training challenge. I mean, everything right across the board.
Yeah, and I saw a quote from Denise saying it was probably the biggest training challenge that the organization's had, and at least in her history, which I know is fairly. She's a long tenured employee, so that goes back a bit. So one thing I neglected to mention at the beginning of this is that we do have a Q&A box, and we'll reserve time for questions for Kevin at the end. But if anything comes to mind, please just park that question in the Q&A, and we'll get to it either at the end or during our conversation. So please feel free to use that feature. But Kevin, we honored both Penn Medicine as an institution and you as a leader at our last event in November of 2020. And a lot of that was related to the work that the organization had done through the pandemic. I think I saw a quote in an article as I was researching for this conversation that the ribbon cutting ceremony at Chester County Hospital on March 6th was maybe the last normal day that you've had till today. So, the pandemic comes on us quickly and unexpectedly to a certain extent. as you realize kind of what the enormity of the situation is, when you're working with your leadership team in the spring of last year, what are you establishing kind of as the immediate priorities for the organization, and both managing the work that you'll be doing in supporting the health of the community, and then supporting those employees who are doing that good work for you?
So back in, as you mentioned, March 6th, we opened the new pavilion at Chester County Hospital, and I continue to use that day as the last normal day in Penn medicine. Every day since has been heroic and terrific, and just amazed at the work that my colleagues and every healthcare delivery system, Jefferson Temple, Mainline, CHOP, has been able to undertake over the last 18 months or so. We immediately established, John, something we called the 3 Ps and an I. We needed to protect our employees, protect our finances, protect our patients, and we needed to innovate our way out of it. And we use those criteria for almost every decision we made early on. So protecting our people, we on early in March, we announced a no layoff pledge. And said, no, at the time, Mayo and others were announcing large reductions. We said, no one's going to lose their job over the pandemic. We established an emergency fund that people could tap into for $500 grants, no questions asked. And that was helpful as people, spouses, partners, others were losing their job. They needed some additional resources. We also pledged that nobody would miss a paycheck. And although you may not have been working because, we had to cut back so quickly because of the non-elective surgery, we still paid everybody. And they have COVID loans that they will be able to pay back over time. But protecting our employees was just critical, protecting our people, protecting our patients. We had to learn on the fly. We were calling Italy, our colleagues in Spain, New York City. What do you see? What's going on? What should we adapt? Nursing to nurse, doctor to doctor, respiratory therapist to respiratory therapist. And we iterated. So Philadelphia benefited because we were not first. And we were able to learn from what other people were doing. And then the finances was critical. In order to make that first guarantee of no one loses their job, nobody loses their paycheck, we knew cash was going to be a problem. So we immediately tapped into our letter of credit and drew down about $150 million so we could make some of those promises that we had set out.
I had heard about the 3 Ps before, but I hadn't heard about the I. And I'm curious as to kind of what does the I, the innovation, mean to you? I know telemedicine is probably a part of that, but can you talk to me about kind of how the organization has innovated as a result of COVID, and how it's accelerated some things that maybe were already on the books?
Sure. I think telemedicine is probably the example that most people utilize. I think what's going to come out more, though, is the critical position we all have to take. We have to have hospital care and ambulatory care, which we know about. But increasingly, we need better home care. We need hospital at home. And we need virtual medicine that we talked about, not just FaceTime with your doctor, but true virtual medicine where we're monitoring you at home and keeping you out of the hospital. So 2 quick examples of that, John. We moved chemotherapy that had been given as an inpatient into the home.
Wow.
And we did it because it was a crisis. We would not have done it before that because reimbursement rules were such that inpatient safety regulations, but because of the crisis, and because the patients needed their chemotherapy, we did it at home. And there's a great story about it in the Inquirer, seeing the patient with his puppy at home, sitting in his favorite chair with the dog beside him, getting the chemotherapy. Who wouldn't want us to continue to accelerate that forward? So I think that is proven to be a critical measure of our future. Will be, how do we innovate and truly deliver hospital at home? The other, on the virtual side, I'll use COVID Watch, which was an app we put on the phone. Remember, everybody wanted to get tested. It's hard to believe, in the spring of 2020, everybody wanted a test and they would pay me cash if I could just test them. Then it was everybody wanted a vaccine and they pay me cash. Now we have plenty of supply of both, and we can't get everyone to take them. But back in the time, if you tested positive, you immediately thought, death was at the door and I needed to get to the hospital.
Right.
We gave the patient an app we called COVID Watch, which was a symptom checker, but also allowed pulse oximetry and other physiological monitoring to be fed directly back to the doctor. And if we were able to keep that patient at home and help them weather the disease, it was so much better than coming into the ER waiting room where you're cross-infecting, where you can't have visitors with you. So, but if you got sick and you were declining in a hurry, we knew it because of the COVID Watch, and we would immediately get you in and triage quickly into the system. So I think those are just two examples. The third I might offer is our e-alert system. So we monitor every critical care bed across the health system. It's now several hundred that are monitored from 18th and South Street at the old Graduate facility. So as patients were coming into Princeton was not ready for that influx of all these ICU patients. So we were able to use our tele-ICU to help manage those patients at Princeton centrally from Philadelphia. So there was an extra doctor, extra nurses on hand helping to watch the patients remotely.
Tremendous innovation and all directed towards immediate support to the community. Kevin, all these initiatives around the changing the way people work, the issues around keeping people fully employed, all HR people issues. And I know that you and the team did a lot of innovative work in that area, from the Lunch with Leaders series to Penn Medicine Together. Can you talk to me a little bit about how you leaned on your HR group during that time to get all of this work done? Yeah,
no, I think part of this also applies to Barbara's question in the chat box. So when my first job at Bryn Mawr Hospital, I was amazed that everybody knew the rules, everybody knew the culture, because people came to Bryn Mawr and they never left. And it was passed on orally. You just went and asked your coworker and they could tell you every policy and exactly how things were done. As we got larger and we started to, we came to Penn and we started to create a larger system, we then went to a written policy manual. And God forbid everybody was referred back to policy number 11000746 and you read it. One of the things we found out from the pandemic, and how did you keep the culture going? How do people know? We had to turn to social media, to video, because remember, people were remote. People, some people were out, some people were in the hospital. So it was critical for HR to help guide me through new communication vehicles. We did a daily email to managers. This is not unique to Penn, but I think the thing that was new for us was the use of video to communicate our message in small snippets, often through social media, to just make sure everybody. The other thing, John, I just take everybody back to spring. We were as worried about our families as we were about ourselves. The doctor going home, living in the garage because didn't want to infect their. So how could you also get a message to the family? Well, rather than having the employee come home and say, this is what Kevin had to say, they could show them the video. And I think it helped pull everyone together.
That's great. That's great. Thank you, Kevin. So you're managing this enormous crisis through the early spring, and then another enormous crisis kind of comes to you in late May with the murder of George Floyd. And you talked about visuals of the gentleman getting a chemo at home with a puppy in his lap. I think one of the visuals I remember from that time, Kevin, was hundreds of Penn Medicine employees taking a knee at Franklin Field in June, and what an important symbolic gesture that was. But I think what we all appreciate is that that was kind of part of a continuum of work that you guys have been doing in DE&I. It didn't start there and it didn't end there. So I'd like to talk a little bit to you about what followed. I know you created Vaccination roles for diversity and inclusion in every clinical department. Shortly after that, that you've instituted unconscious bias training throughout the organization. What else has the system done, UPHS, Penn Medicine done on DE&I that you'd like us to know about?
Sure. So I think there are a couple ideas I'll toss out. First of all, when we had, as every hospital did, white coats for Black Lives back in May, Rennie Polite said, "You're going to kneel for 9 minutes and 46 seconds, and you're going to be uncomfortable."
Mm-hmm.
And I want you to remember that being uncomfortable, because that's the only way change really happens. And I've said this many times to our employees. I grew up in a generation in the 60s and 70s, like we thought like we had solved this problem.
Mm-hmm.
The Voter Right Act was passed. We had a much different outlook, I did, than my father did. But looking back, we deluded ourselves. We're the baby boomers. We now box check, not a problem, but it's a terrible problem. So that uncomfortable feeling, that those kneeling for 9 minutes and 46 seconds, I remind our management team every day that we have to be intentional about solving this problem. Mm-hmm. So in addition to, increasing awareness of our workforce, just culture, a couple things I would point to is we're putting in a program of reverse mentoring. So, like a lot of us on the call, people call us and say, "Kevin, would you be my mentor? Because I want to be a CEO." And I think Jack Welch did this at GE. It's called reverse mentoring. So the executives on the C-suite are being mentored by the community health workers out in West Philadelphia. They're not coming up to the C-suite to talk about it. The executives have to go for a year. It's a year-long program. It has metrics. It's got measures. It's a serious effort. But that reverse mentoring is going to be critical as we move forward. The other thing that we did is social determinants of health are certainly critical, and we've all talked about getting research grants, and we need state money, we need city money to take these on. I am a firm believer that the only way to make sustainable change is through capitalism. Mm-hmm. And I can donate $25,000 to this organization, $30,000 to that organization. I can volunteer. All that's critical. But a company that creates jobs, that moves forward, but has a social mission, we think it is just the way. So we started a social impact fund with Wharton. We recently funded 3 companies. My favorite example is the K Involved, it's called. Mm-hmm. And it makes sure, if you remember that young man that was driving that had got pulled over because he had the air fresheners on his car. And then they ran, he had a warrant. He missed a parole hearing. You miss a parole hearing, you're getting arrested. If I got arrested for every meeting I missed, I'd be in jail for the rest of my life. But part of the issue is the kids don't have a landline. They don't get U.S. mail. They don't have a nuclear family that's reminding them to get going. So this uses text messaging. It gets the hearings from the criminal justice system and makes sure that the kids show up. And we think that's going to be a critical step forward. So funding those at $5 million a year, I think, is an example of trying to solve the problem, not just Band-Aid it and not just make statements, but truly try to get underneath it.
The Fund for Health, the work that you're doing with I think it's the Wharton Center for Social Impact in that regard, great in terms of both providing services to the community and creating jobs in the community. But I really appreciate also what you've done from an access standpoint. I know Jamie Gauthier called you back in February 2020 when Mercy Philadelphia was about to close, and really innovative work that you did with the Public Health Management Corporation. Can you talk a little bit about kind of, creating equity and access through the program that you did to make sure that facility stayed open and maybe is more important to the community now than it was prior to this transition?
Sure. So we're going to continue to see inpatient beds close in the Delaware Valley. It's just as technology improves, as the delivery of medicine improves, we're going to need far less inpatient beds. But the problem, John, is it's a jagged slope down. It doesn't just happen. So our colleagues at Trinity were close affiliates. They said, they couldn't continue to provide the inpatient care. We could have taken the position, we're opening 500 beds, as you mentioned. We could absorb those 40 or 50 inpatients a day into Penn Presbyterian and Hupp. It's only 20 blocks, but it's a couple miles. It's several bus routes if you have to do it. It's not convenient. It's hard. So we made the decision. Our goal and our aspiration is not to create another hospital, but rather a healthy village. And my measure of success is 5 years from now. The old Misericordia campus is a beehive of activity, but not inpatient beds.
Right.
And I believe we can achieve that. So it's on the HUP license, and during that period of time, we're providing great quality care, doing a lot of e-consults. But as you said, trying to make sure that families in West Philadelphia who lost their local hospital because Medicaid doesn't pay enough is able to continue to access care. Again, as we mentioned, we're going to put in a primary care health clinic with a PHMC. We're going to do some behavioral health beds with Children's Hospital. Independence Blue Cross Foundation is helping us fund some of this. So it's really, it's a community effort to try to replace. Hahnemann closed, and all you heard was the safety net hospital closed. And I keep preaching, we don't need safety net hospitals. We need safety net programs. We need a safety net system that is going to be much more ambulatory than it's going to be inpatient. And trying to reset everyone's minds towards how do we develop those safety nets that are more home-based, more ambulatory, and more virtual.
Great. Thank you, Kevin. Just curious, I don't know if those employees came onto your payroll or the folks who are working on that campus now, but any HR challenges that need to be addressed in that work with PHMC?
I think the other thing that I learned through the pandemic is perfect's the enemy of the good.
Right.
So, I told the city council woman, I said to Council Member Gaudier, everyone will keep their jobs.
Right.
Penn and Mercy, Fitzgerald Mercy, everyone has a job. And as I said that, people started to immediately say, wait a minute, they got to pass their drug test. They got to pass their criminal background check. They have to. So you could water down the message, and there's always going to be exceptions like that. Important to me was to be clear in our communication that everyone has a position. Jennersville Hospital announced their closure yesterday.
Yes.
And between Tower and Penn, we said no one's losing their job. And there are so many assets in the community that we can get people placed. But we need to, back to social determinants of health, I think the number one social determinant of health is economic security. So let's make sure that we keep creating jobs. Michael started, we talked about Comcast business. The digital divide in West Philly, where people don't have access to some of the telehealth, didn't have access. Remember, we went virtual in school, and Comcast stepped in and said, we're going to provide hotspots for every Philadelphia school district attendee. We as a community need to join together to solve those problems. I can't provide telehealth if they don't have a hotspot, if they don't have access to broadband. So when Comcast stepped in and helped us provide that, then we could follow on and do the telehealth. So I think all of us collectively really just need to continue to step up. Steve Klasko and I talk about this a lot. We don't think we compete against each other. We compete against cancer. We compete against cardiology disease, diabetes care, behavioral health. And we should be focused on how do we improve those as opposed to how do we get market share from each other.
Right. Great. Yeah. Very, very important to be collaborative in that regard. I have a question that kind of fits in with what Chris's question is on vaccination. You announced early, right, in May, I think, that you were going to require vaccinations, and at that time, you were one of the first healthcare institutions to do it, and certainly the largest. Just curious, why was it important for you to lead the industry in that regard?
So we thought it was critical that as a scientific organization founded by Ben Franklin, one of the world's great inventors, as the institution that developed the vaccine, and we know vaccines work. The evidence is indisputable. We thought we needed to take a leadership position. And on May 19th, we took that position. Did everyone get vaccinated? No. Did 99.5% get vaccinated? Yes. And everyone's eligible for rehire. Hopefully they'll reconsider and come back. But we just thought it was critical from a public health perspective, and most importantly, to protect our patients. Because I started to get emails from patients. How do I know I'm a cancer patient? How do I know the phlebotomist drawing my blood is vaccinated? I'm wearing my mask. I'm staying away from people at home. I want to make sure. So it was to protect each other. It was to protect our patients.
Yeah, and talking about compliance, I just saw the Inquirer article from a few weeks ago that I think of the 40,000 plus people who work in Penn Medicine facilities, maybe less than 400 ended up not getting vaccinated by choice, where they weren't covered by an exemption. And it sounds like most of the exemptions you got were for folks who've just decided to delay it a little bit.
Most of the exemptions were medical,
right,
and most were temporary.
Yep.
So pregnancy was an automatic exemption, and people are getting tested. But September 1st, I mean, this is probably true of every organization. I don't think some people believed us. So 179 people on September 1st got vaccinated because I think they thought we were just kidding.
Right.
So. But it has been a team effort, and every healthcare organization, university has to comply by October 15th. And the other thing we've tried to do is to share our learnings, to share our exemptions, our policies, and we've sent those out across the country. I think Kathleen has an interesting question on how are we supporting our employees. Early on, we developed what we call Penn Cobalt.
Okay.
And it is a web-based access for employees. I refer to it as open table for behavioral health. It's probably a lousy term, but it illustrates, you go on the website, if self-help, resilience, a little mindfulness training is what you need. It'll take you there. If you need to talk, as you go through the criteria and answer the questions, if you need to talk to a licensed social worker, you get that scheduled right away. If you're making it cascading through these questions and you need to talk to a clinical psychologist, you get that appointment right away. Not if you're going through and you need a psychiatrist, if you're having suicidal ideations, if it's just too much, you get to a psychiatrist right away.
Right.
So it was critical. Again, back to protecting our people, that they had the ability to access the services that they need. So that was one. The second was, we wanted to make sure that we would never ask an employee to step into the breach unless they had complete personal protective equipment, unless we maintained our staffing. It was just critical that the employees knew they came first. And I believe we're able to communicate and achieve that. As we go into the new workforce shortages, together we're going to have to talk about flexible staffing. The young nurse starting out, maybe they want an MSN. How can we help them get that and work at the same time? A nurse at the end of the career who maybe only wants to work every other week. Like, we're going to have to become much more nimble at giving people the flexibility to take time off, because without, it's just like everybody knows, the grind is going to be the end of all of us. So we're trying to adapt, as Kathleen is suggesting, to make it a much more flexible workforce rules than we've had in the past.
Absolutely. Just a quick plug. I know there's some good HR leaders from Penn Medicine on the call here, Cindy Morgan and Chris Tierney and David Shape. There are, at least as of a few weeks ago, 600 jobs open for the new pavilion. So if you have an interest in working at one of the state-of-the-art healthcare facilities in the world, there's opportunity. So Scott Rosen had a question as well for us, Kevin. It's how is your kind of understanding of HR and its contribution to the success of the organizations you work for evolved during your career? As you've moved into more senior roles, and I know for the last several years you've had the human resources function reporting at you directly. So what have your learnings been as a leader in terms of what a good HR function can do for an organization like Penn Medicine?
Yeah. So John, part of my career, I was actually the head of HR at Episcopal Hospital back in the 80s. And I think much of my career success is based on two things. One, growing up in a very large family where I had to learn to negotiate from birth forward. And second was having your first job in HR. And, I was a kid from the suburbs, pulled into Episcopal Hospital and back to I pulled out the rule book. Mm-hmm. And I was the cop. And anybody crossed me, man, they got written up and thrown in the clink. And I look back saying how stupid that was, because I didn't know the employees. I didn't know what it was like to be a single mom in Kensington and things like that. So it really helped evolve me forward. As you know, and everybody on the phone knows, HR has become our critical people strategy in an organization of healthcare, is the only way we're going to succeed. So we're about to launch what we call Project Vital Advantage, which is how we can get organized across our 40,000 employees: recruitment, retention, loan forgiveness, development, flexible staffing. Mm-hmm. Some of the intrinsic things that are so important to employees right now around climate change. Mm. So one of the things we made sure was that the pavilion achieved LEED Gold status. It'll be the largest healthcare building to achieve that. We're also talking about sharply, if not completely, subsidizing SEPTA for our employees to get people off the highways, because mm-hmm. employees want to be part of a team that believes in their values, and climate change for particularly younger employees is just so critical. But Denise, Cindy, Chris, you mentioned Chris, the nation's first hospital. Yes. We at Penn, we weathered 1918, mm-hmm. and we've weathered this, and a lot of it is Chris shares the learnings from Pennsylvania Hospital up to HUP, and everything was I'm hoping that we can continue that nimbleness of thought, the agility of thought that we had during the early days of the pandemic, and keep moving forward with that speed. But I can't say out of all my functions. Don't tell Keith Casper, our finance. But of all of our functions, HR and our people strategy is going to win the day for us.
Absolutely. Well, it's great to hear that. And we got a question from James here too, related to the mental health aspect of the work that you do. Seeing that as the fastest growing component of healthcare costs for all employees going forward, how do you see Penn Medicine positioned to meet this need? Any thoughts that you can give James in that regard?
No, terrific. So we're working with the Hospital Association. We also have a bi-weekly meeting with Jeff Temple, Mainline, and CHOP to talk this through. It is the fastest growing component of healthcare costs, but it is the worst dollar spend ever. Our behavioral health system is just flat out broken, and we all need to get together on the delivery side and fix it, which will then roll down to the benefit side, because you'll get more value for your benefit spend in behavioral health. But after social justice, after the people strategy, it is right up there of critical things that as a city, as a region, we have to tackle. And we've been lobbying Harrisburg to give us some freedom to do that.
Somebody asked for Chris Tierney's email. I could probably give that to you offline. Oh wait, Chris just gave it out there. So good for you, Chris. Chris is the great CHRO of Pennsylvania Hospital, the nation's oldest hospital, I think, established in 1751, soon to be followed by the nation's first medical school, the University of Pennsylvania, in 1765. So, Penn Medicine UPHS has been a part of the fabric of this community pretty much since the founding of our country. So,
could I, John?
Yeah, please go ahead.
Two other things real quick.
Ahead,
I apologize for. And then at the very end, I just wanted to say one thing as well. The policy for people who are not tested or not vaccinated, if they have an exemption, they have to get tested. So, regardless of where you are in the Delaware Valley, you have to get tested twice a week if you're exempted. Now, if you didn't get if you were exempted, which is legitimate, it's not an excuse. If we granted the exception and you're working remote, you don't have to get tested. But if you're in a patient care area, you got to get tested twice a week.
Fair enough. So with that,
Mike had one other question about natural immunity.
Sure.
I want to address this because
Please.
So many of our employees said, I tested positive for COVID. I had COVID. I'm immune. We did not accept natural immunity, but that was after discussions with our physicians. And there's actually a lot in the literature that if you had COVID and you have natural immunity plus the vaccination, you're super immune. Like you shouldn't run away from it. You should sign up for it quickly. Mike asked a question on diversity, and in addition, again, to the normal counts of applicants, hiring, all the things that EOC taught us. We also, as a healthcare provider, we put into our incentive plan for 668 management level personnel that we needed to reduce the maternal morbidity amongst Black patients delivering. And we tied significant portion of my pay and everyone's at the executive leadership. And also we wanted to increase the rate of colorectal cancer screening among Black males in our area. So it was the first time that we put health equity and diversity measures directly into the incentive plan of our top leadership. And I'm pleased that they achieved high performance. We shouldn't ever underestimate the value of incentives, and I think that was important.
I have a short question here, and I'm going to have to end on that. Kevin, do you know who, in terms of the cost of testing, is that something that the system is bearing, or?
Yes,
okay.
The system's, it's a condition of employment, so we're bearing that. John, if I could, just one last thing. I want to congratulate my great friend and colleague Tony Pergolin on being CEO of the year. Tony and I worked together at Penn years ago. There's not a more mission-driven, dedicated leader than Tony Pergolin. So when it comes to CEO of the year, the rest of us are just playing for second because she is phenomenal. Congratulations on her selection.
Well, she is a wonderful person to pass the torch to from your honoring last year, Kevin. And I do want to thank you for participating today. It's been a very insightful discussion, and appreciate your flexibility and your willingness to participate, and also answer the great questions that we've had in the chat box. And again, we appreciate what this UPHS Penn Medicine means to the community, and the great work that your HR team is doing, who were also recognized last year for their work in talent acquisition and wellness. So thank you again, Kevin. We really appreciate it. And with that, we'll close out this part of the proceeding, and I will hand it back to Scott Rosen.
Thank you, John, and thank you so much, Kevin, for a really terrific and enlightening conversation. So, continued best of luck to you and the health system. So, I'm going to now just do a couple other spotlights. I'd like to introduce Christina Cole, Managing Principal of HR Computes, who's going to tell you a little bit about her organization.
Thank you, Scott, and what a wonderful conversation with Kevin. So much of the work that we do at HR Computes dovetails with many of the diversity, equity, and inclusion initiatives that Kevin was speaking about. While many of you know us as a technology transformation firm focused on people strategy, we also use those skills to help organizations on their JEDI journey, meaning justice, equity, diversity, and inclusion. And as Kevin was highlighting in his conversation, it's really moving beyond mandatory trainings and check the box approaches. It's really delving deep and being intentional in what are your strategic objectives and how can we help you get there. So there's a big part of our practice in our Becoming Sustainable group, and that is an area of the practice that I lead. We are so thrilled to be a sponsor, and we look forward to meeting all the nominees and the award winners in November. And congratulations to the winners of the CEO award and I don't even remember the second award now, but anyway, congratulations to the winners that were announced today. And we look forward to chatting with all of you in the future. Thank
Thanks,
you.
Chris. Lifetime Achievement Award.
Lifetime achievement. Good.
No problem. Thank you, Chris. And finally, we have Steve Skovner, Sales Director at Contemporary Staffing Solutions, another sponsor. Thank you, Steve.
Thank you, Scott. And also thank you to Kevin and John for a fantastic and extremely informative chat today. So CSS, or Contemporary Staffing Solutions, has been a staffing provider for over 27 years. I have been with CSS for 7 of those years and now a sales director. We are locally headquartered with the majority of our offices in the greater Philadelphia area. That being said, we did place candidates in 46 states last year, so we are considered a national firm. We have multiple business units at CSS that focus on specific niches. The division that I lead specializes in HR, office call center, accounting, finance, and other back office roles. We have additional divisions that specialize in IT roles, high-level sales positions, and Salesforce projects. Lastly, we are an MSP provider for many large organizations. Although our name has the word temporary in it, contemporary staffing, we do place direct hire individuals as well. I'd be happy to connect with anyone on the call if you have any questions about CSS or our capabilities. I'd love to be a resource for anyone who is currently looking for a new role or is in need of additional support with their organization's hiring efforts. We are a partner of Christianacare, Temple, and Jefferson on the non-clinical side. Just want to throw that out there in case anybody from Penn was still listening. Thank you so much for the opportunity to speak about CSS, and thank you again, Scott, and the whole team.
Thank you, Steve. So we're wrapping up here. I do want to do 2 quick other shout outs. One, I want to thank Laura and Seamless Events for doing a great job for us in terms of coordinating the HR Awards program from beginning to end. They have been with us for many, many years now, and we are very grateful of your services. So thank you to Laura and the Seamless Events team. And also I want to do a shout out to Mark Spool. Mark is both the leader of the judging group and has been with the HR Awards program for many years. Mark, I want to thank you so much for your service. You've done a great job, not only of leading the judges, but also of working with companies to really help them facilitate their application process as well. So thank you so much, Mark. And also I want to thank the judges, most of whom are past winners and who have done a great job over the years helping to evaluate companies. And, I always say we're not the Malcolm Baldrige Awards, but we're also not a fluff program. We take our role seriously in evaluating HR departments, and hopefully that's evidenced in the quality of our program. So lastly, just again, want to remind everybody, November 10th, 5:30 to 9. Registration is now open, hrawards.org, and we will be observing protocols during the event. Thank you, everyone. Thank you, Kevin. Thank you, John. Great event, and have a great day, everyone.